You're watching Reality Check. As we hit the end of what has been a devastating year of the pandemic in India, we are again at an inflection point with the pandemic. On one hand, there are fears of an Omicron-fueled third wave. On the other, our vaccine rollout expands ever further, with the government now announcing booster shots for target groups and vaccines for children. The path of Omicron itself seems complex. Not all bad news. Even as it surges, it doesn't seem to be leading to the kind of devastation witnessed in earlier waves, at least in other countries. Now, it is certainly fueling waves, possibly in countries around the world. In the US, it's almost up 135% of cases. In the UK, up almost 150% cases. Denmark, up almost 180% cases. And South Africa, it crossed a 600% surge. And yet in South Africa itself, considered to be one of the epicenters of the Omicron wave, the virus seems to be falling off its peak as rapidly as it rose. If you just look at the average daily new cases for South Africa in a week-to-week comparison, right down to the most recent week, it's almost down by about 25%. Additionally, 3 recent studies are indicating that Omicron may be less of a threat than it seemed. These are studies that have been conducted around the world, that the infections might result in milder illness even if it is more contagious. These were conducted in Scotland, South Africa and England. The Scotland study found that if Omicron was Delta, there will be 3x more hospitalizations. South Africa found that Omicron sufferers were 70 to 80% less likely to be hospitalized. The England study found that Omicron sufferers are 15 to 20% less likely to be hospitalized versus the Delta variant. Now, in India, while Omicron numbers are rising, the absolute numbers are very low at the moment, hovering just under less than 1,000 cases. And the overall curve of the pandemic hasn't significantly risen yet if one looks at the COVID graph of the overall curve when it comes to India. However, a government lab has found that 25 to 30% of COVID cases in Delhi are Omicron, up from 2 to 3% 2 weeks ago, indicating that Omicron might silently become the dominant variant very soon. But unlike the second wave, Indians do have a greater degree of vaccine protection. India's vaccination status at the moment, fully vaccinated, we're talking of the whole population now, 42%, only 1 dose, 18%. All right, joining me tonight on Reality Check, we have a great panel with us. We have Dr. Jayaprakash Mulyal, who's chairperson of the Scientific Advisory Committee of the National Institute of Epidemiology, one of India's leading epidemiologists. Professor K. Srinath Reddy, President, Public Health Foundation of India. Viren Shetty, Chief Operating Officer from Bangalore, the Narayana Health Enterprise. And Dr. Rachna Kucheria, she's an epidemiologist, public health expert. Let me just start with you, Dr. Mulyal, to understand from you, based on all of this, all of these different numbers and trends that we're seeing, what is it looking like to you? Are we likely to see some kind of Omicron-fueled third wave in India, or not really?
It would be very easy to answer yes or no, but I am tempted to paraphrase it in terms of it was a shifting value system that we had to have. Initially, this came so rapidly, with the doubling time in certain areas, 2 days, it was frightening. But at the same time, it wasn't making any waves in terms of hospitalization, like you said. So that was a consoling thought. But the most important thing, or a piece of evidence that you narrated just now, is the rapid fall in South Africa. Remember, compared to Denmark, South Africa's method of collecting data is nowhere. So it looks like countries that have a good system of documenting all the new variant on testing have a higher rate of the Delta. On the other hand, one little information you left out in your presentation, we, like South Africa, have a huge naturally acquired immunity. And I think of late studies have shown that makes a huge difference. Now that is what I think India's trump card is. More than 80% have acquired immunity through infection, plus the 140 crore doses of vaccine. Given this background, we have to understand that we are in a great shape to face this Omicron.
Okay.
A wave may be there, but unless it creates a consequence in terms of health, then it is not to be worried about.
Okay, interesting. So what you're saying is, and just to kind of break this down a little bit for our viewers, that because of the fact that, and I think you're referring to what are called sero surveys, or which are sort of blood test surveys which are done, which show that a huge percentage of the population, much more than what the actual COVID positive, the tests show, that 70, 80%, in some cases, in some cities, almost 90% of the population may have already been infected with the virus. On top of that, the vaccine protection, you're saying that gives us some kind of Lakshman Rekha, some protection against Omicron. So even if Omicron is more contagious, the number of cases are spiking, it may not be as deadly. Is that
Exactly.
Right?
You put it nicely.
Okay, but that's okay. Srinath Reddy, do you agree with that, or is that a bit of a roll of the dice?
No, I do agree with an optimistic scenario because I do believe that Omicron has a milder infection. While many people may get infected, the number of people who will get severely infected as a fraction of those who got infected will not be high. But it is in our interest to keep even the total number infected low, because even if the fraction is low, if there are very large numbers infected, we'll still have many people landing up in hospitals. I'm not very sanguine, though, about the full protection that is provided by previous immunity, because we have seen Omicron crossing that boundary in every country that is recorded, whether it is vaccine-induced immunity or previously infection-induced immunity. Though I believe natural infection with a larger platter of antigens would give a better immunity than just a spike protein focused vaccine.
Okay,
Nevertheless,
that's a bit technical. Sorry, I have to stop you there for a second. You're saying natural immunity, which is of course the fact that if you mean you already have you've been infected in the past, along with what else? The platter, if you could just simplify that.
No. See, the virus has many antigens. And if you have a natural infection, your immunity is directed against a broader array of antigens.
Okay.
Where most of the vaccines that have been used so far have been directed mostly against the spike protein. They've been spike specific.
Okay.
So if the virus develops a large number of spike protein mutations, there is a greater likelihood of the virus escaping that immunity. So I believe the fact that many people would have been infected during the second wave does give us a great advantage. But nevertheless, we cannot rest comfort only on the basis of the sero surveys, because we do not know how long that immunity has lasted of people. We should take precautions nevertheless, while keeping the optimistic scenario in mind.
Okay. Before I move to the others, I just want to come back to Dr. Mulyal for just one question related to what Srinath Reddy said, that given the fact that there is evidence of what is called breakthrough infections with Omicron, that people who may already have had the virus are getting it again, do you get the sense, Dr. Mulyal, that Omicron is amongst us? It is here much more than what the numbers are showing. The official numbers are just in the range of 1,000. But as we just saw that figure from Delhi, 25 to 30% of new cases are Omicron. So it may not be packing out hospitals and ICUs yet, but is it already prevalent, you think, in India much more than what the numbers show?
Circumstances suggest yes, there is much more. Remember, we only diagnose our diagnostic skills for diagnosing Omicron is limited. So our counts are all wrong. As it is, we only detect a fraction of the cases. And then of that a fraction, that is very minute. And the best way to suspect Omicron's presence in a troublesome way is to watch our standard curve and how it's falling now. If it starts climbing back again as it did in South Africa, then you will know the guy is around.
Okay,
So,
the guys, okay. Viren Shetty, from the point of view of someone who works in the healthcare space, what are you picking up? Because, just again, anecdotally, as the other experts were saying, we're not seeing, at the moment at least, fingers crossed, knock on wood, a big surge of hospitalizations, ICUs getting packed.
You're right. We're not seeing it precisely because it's so much of a known quantity by this point. Unlike in the first wave, where as per the current thinking, any COVID positive patient was admitted to a hospital. Whereas now, since it can be managed at home, although right now, if, for example, a person is diagnosed as Omicron positive, some people in the government have decided that it's better that they get admitted to a hospital. Whether that's medically necessary or not is beyond my ability to comment on.
Sure.
But hospitals will not be full as long as we're defining that you don't need to be in a hospital unless you're really sick. And if it is true that Omicron causes lesser sickness, we would expect that hospitals won't be full for a long, long time, provided it spreads rapidly throughout the population. And even if it has a very small chance of making people sick, the fact that we have very large numbers and means that we will reach that point eventually, but it could very well likely be it's very spread out and it will get rolled into the overall burden of sickness that most hospitals in India deal with.
Okay.
So I would say at this point, it looks probable that it may not be a point of concern.
Okay, again, fingers crossed, lots of caveats. But Dr. Rachna Kocheria, this is interesting because on one hand, concerns about a kind of Omicron-fueled COVID resurgence, whether it turns out to be deadly or not, but those are fears. Governments are enforcing all sorts of increased restrictions, quasi-lockdowns and so on. On the other hand, people are out and about. I mean, there are huge crowds gathering everywhere for markets, for bazaars, for political rallies as well. So is that a kind of strange paradox, and is that a worry?
It is a worry, and I'll speak from the point of view, you have all the experts here, of a practicing public health physician. The time is not to be, complacently optimistic. It's to be very cautiously optimistic, and at best, if we weren't that, we'd be foolhardy. The data is coming in. It's very little. We've got 3 or 4 studies to bank upon, but it is showing, like you said, and I'll give it a slightly different spin, like you said, 2 to 3 to 5 times more transmissible, this Omicron. And if it's even, let's say, half or 1/3 the severity, we're still talking about 1.5 times more cases. If you add the two together, it's going to spread faster. And in a pandemic, we've already seen this happen. When this happens, any country, most countries, systems will get overwhelmed quickly. So I think it's a bit foolhardy now. Everybody had a break. I'm just going to talk very simplistically. There was pandemic fatigue. Everybody had a break. And I think so that people's livelihoods are not affected, this is the time to roll up your sleeves and cut back, move back. We already know what is to be done. Masks did work. The booster shot is being rolled out. Get the second shot if you haven't done so already. And one other point I'd like to really make is, since we already know from the data coming in from other countries that it's about 2 to 3 to 5 times more transmissible, I think what needs to be done and thought of at this stage, as much as oxygen and hospital and all of that, I'll speak from the community perspective. How are you going to isolate people at a community level? And I'm not talking about those who have 2 or 3 rooms in their homes. I'm talking about the masses of India where people live in one dwelling. How are you going to separate out those who will be at risk, the older elderly, or those with comorbidities, from those who are getting the transmission, because this is going to really transmit fast. So those are things we need to focus right now and not dawdle, I would say.
Okay. And of course, at the same time, Dr. Mulyal, the vaccination rollout is again going to be an important ring of protection. But if one looks at what has been happening to our vaccination program, even as we now expand it to include booster shots or precautionary doses, as the government is calling it, for reasons which are still not entirely clear, there is a bit of a worry in terms of the way the numbers are falling off. We were doing at our peak about 95 lakh doses a day, vaccines being administered. That's fallen almost by half to in the range of about 50 odd lakh doses a day in the last odd week of December. And this is even before boosters are going to be rolled out. worrying or?
Well, the cup is either half full or half empty. So you can say we still have a long way to go, but I say we have come a long way. The performance in terms of vaccinating such a huge population has been quite remarkable, and the people involved in it should be congratulated. One. The second thing I said was that we have been with this virus for 2 years. Now, this Omicron is the same can of fellows. It is ability to infect a little more, like our friend said. So it may get through. I agree with that. But the only ray of hope I find even now is a reported low seriousness everywhere, similarly, including the fall off in South Africa.
Okay. Will the boost, are boosters necessary though? Will they help?
See, I could easily say yes or no, but I have no evidence to suggest it.
Okay.
Because it's a new virus, and people have reported that even after 3 doses, they have got Omicron.
Right.
But not seriously. But please don't forget, the vaccine protective effect is not against infection. It is against serious outcomes.
Of course. It's to reduce severity. Srinath Reddy, on 2 things, on the fact that our vaccine, pace has somewhat dipped, and also on boosters. It appears, again, we don't have very clear guidance on this, that the government seems to be indicating that the booster or the precautionary dose in the case of Covishield is likely to be a 3rd dose of Covishield, even though now other vaccines, Covovax and Corbevax, have also been given emergency use approval. Is that a sensible idea, a 3rd dose of Covishield?
Firstly, in terms of the number of people vaccinated, I would agree with Dr. Mullial that we should not take the denominator as the entire population of India.
Okay.
If you take the adult population, or even if you start from age of 12, we've still covered a fair amount of territory.
Right.
And we do need to speed it up, of course. As far as the question related to whether the booster should be a different vaccine, what is called a heterologous booster, that on the array of vaccines that we have available, and it is for the government to decide whether one of the 2 new subunit protein vaccines is going to be also pressed into action as a precautionary dose or as a booster dose. That's for the government to decide. But yes, we do not have clear-cut evidence of which array or relay of vaccines works much better in our context.
Okay.
In terms of the heterologous booster. All the evidence that is available is about mRNA vaccines and the AstraZeneca vaccine abroad. So in the absence of that, if you want to take a leap of faith, then you can go in for a heterologous booster with a different vaccine than the one previously administered. But that also depends on the supply situation.
Yes.
Now, therefore, if you're constrained about the supply and you're not certain about the evidence, you might as well go in for the same vaccine if it is available.
Yes, because I was about to say it's still 90% Covishield and 10% Bharat Biotech Covaxin. That's the current supply breakup, and there's no clarity on whether that's significantly going to change. But new vaccines are going to come in. But Viren Shetty, the crucial question is, are we ready? Again, God forbid we don't have to relive the nightmares of what happened earlier this year. But there has been talk, as always, sometimes it tends to be big talk about the government says this time, oxygen, beds, all of that. What's the sense you're getting?
We're as ready as we can be. I don't think any infrastructure that you could possibly create in 1 year or even a decade will be able to deal with the kind of surge that will come about if a rapidly spreading unchecked virus with an R0 of 6 or 7 is allowed to spread throughout a population that doesn't have very strong immunity. So in as much as was possible, and with all the lessons that were learned from the first and second waves of the disease, Hospitals like ours, hospitals across the country have equipped themselves with oxygen, with all the medicine that's required, with the training. The treatment protocols haven't changed that much. So in that sense, at least, you're not doing very different things for patients this time around. The infrastructure would not have jumped significantly. Right. So in the event of a surge on the same scale as the Delta variant, I don't expect that the outcome would be any different. What we can hope for is that it doesn't surge as much, or the pre-existing immunity conferred by the Delta surge would still be inactive, and that fewer patients end up in the hospital.
Dr. Kocheria, what are you picking up from the ground, away from the, the big cities which are relatively better equipped? Do you see that there's some attempt to boost health safety nets, especially in the hinterland, or worried? Not
worried. I think that more ground level planning, right at the level of village and panchayat, needs to happen, so that when, and it is spreading, it's in the community, not when, it is, when it comes, then you have systems in place that are simplistic, that don't rely on hospitals so much, that, as I said, are able to isolate those who are infected, because they can be managed at home, and who don't go and then infect seniors and others. So those things need to happen. And one other point I'd like to make, and sorry to be sort of the voice of deep caution in even here, is that, remember, all the studies, most of the studies that we're seeing are coming from countries where double vaccination rates are above 80%, where triple vaccination rates are now hitting 20% and more, and fourth vaccinations are being talked about, where nutrition levels are different, where health systems are different. So when we extrapolate that data and say, yay, this is a mild virus, let's have a lot of deep caution in there. This is not apples and oranges. Okay. I don't want to sound like, the voice of doom, but we need to be cautious. It's good. Out there, the numbers are going up every day.
No, good point. Though South Africa, where the numbers have started to fall off, is not amongst those better kind of protected and vaccinated countries. Vaccination levels are, actually quite poor. But Dr. Mulyal, in conclusion, though, we've talked about the sort of the threats from Omicron from an epidemiological point of view, but from a public behavior and kind of government guidance point of view, what is the way to go? Because like I said earlier, you have the government saying be cautious, and then you also have them going out and holding huge government events and rallies and whatnot. Crowds are, of course, gathering at markets. Is that avoided? Should that be avoided? Should we just, or say, no, it's fine, go ahead? What?
Well, I think the mask is still a protective device.
Right.
Avoiding crowd, we know it. 2 years of training the population of India had in facing COVID. So the only thing is, what we need to do is more purposeful education, which encourages people to continue to behave safely.
Okay.
Very often when you push things down on the throat, they refuse to accept it. Okay. On the other hand, if you use the correct technique, you will be able to encourage them.
Okay. Srinath Reddy, last quick word from you. How do you encourage people to be responsible? I mean, this is cognitive dissonance. You say be cautious, and then you see top government leaders, etc., addressing massive crowded rallies.
Well, we'll have to tell them to protect themselves as well as their family members and other dear ones, and recognizing that there are many things that they cannot completely control. It is masks against mutant attack and vaccines against variant disease.
Okay. That's quite catchy, Srinath Reddy. But anyway, thank you all so much for joining me. It's been very insightful. Wish you all a very good and a safe new year. Thank you so much for joining me, and thank you for watching. Good night.